the Long Beach Green Room's Lowdown. This is episode 4. Here's our disclaimer. We're not doctors, nurses, or medical professionals. The information, including but not limited to text, graphics, images, and other material, are for informational purposes only. The purpose of information material is to promote broad consumer understanding and knowledge of various health topics. It is not intended to be a substitute for professional advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified healthcare provider with any questions you may have regarding medical condition or treatment, and before undertaking a new healthcare regimen. Never disregard professional medical advice or delay in seeking it. All right. Today we have Angela and Cody, Green Room Cannabis Educators. And today's topic is going to be method of delivery. And I'm Pam, your MC. All right, guys.
Hello. Here we are.
Let's talk about
how do you consume cannabis?
How do you consume cannabis?
I am very much a tincture fan and edibles. That's my preference.
How about you, Cody?
I like to hold it until I turn purple.
All right.
No, I like joints and dabs and stuff like that.
Awesome. I'm both. So I like to dab. I like joints, but I also love tinctures, and I really love topicals. And, and edibles. I love edibles too, because I use them very purposefully, because recreationally they just don't agree with me, but medicinally they totally do.
There you go.
You're good for sleep.
Yes, very much so. So what to consider when consuming cannabis? What should we consider? What should we consider about like smoking, right? It's a big thing.
Yeah. Well, you kind of got to consider, first of all, what's your intention? Is it recreational? Is it, and I mean, we'll go into that a little bit more, but what's your intention and when are you going to be consuming it? For medicinal, it's usually throughout the day, you know, whether you're at work or whether you're at home. So, I mean, if you're out and you're at work and you're medicinally using cannabis, and, you know, for me, when I suffered from migraines and stuff like that, which, you know, my story, I haven't had migraines like I used to in the past. You know, it's got to be discreet. It's got to be, you know, I don't want to be, you know, drooling high. You know, I mean, you're going to have to consider your surroundings when you're consuming. So that's, I think, to me, that's one of the things you've got to look at. First of all, what your intentions are and when is it that you're going to be consuming. So, I mean, that's one of the things you've got to really kind of pay attention to.
So really, a lot of these times, like recreational and medicinal use, oftentimes they overlap.
They
right?
do, very much so. So I honestly believe that most people get introduced into cannabis looking to self-medicate. You know, somebody says, oh, I don't, you know, I have pain, I don't feel good, I have this, I have that. They say, here, you know, smoke this, take this, try that. And then they also find out how fun it is. And, you know, because cannabis is fun. I mean, it is, let's just face it. But you can accomplish both. And so then I think they start getting into the aspect of the recreational. It doesn't do as much, you know, harm to your body as, you know, let's say alcohol. You know, it's not damaging your liver. It's not, you know, interrupting your digestive tract. Anybody that's got alcohol aversions and has not good responses with alcohol, cannabis is the perfect recreational, you know, social kind of high. So I think that that's the crossover. but like, especially with you, Pam, you do both. I mean, and I'm mostly medical, but you do both. So there's a method to use when you're, like you just said earlier, for recreation and then for medicinal. So I think understanding and knowing that overlap with your own system. I mean, everybody's endocannabinoid system is different, so everybody's going to react different, and every method isn't going to agree with you. So understanding the intention of you using it at a particular time, whether it is going to be recreation or medicinal, then understanding what you're going to use, what you're going to, what method you're going to use. So that's the overlap. But I do believe that a majority of people do start experimenting and looking towards cannabis because of health issues.
What do people usually say when they come in? So when we have like it's somebody that comes in and they're like,
I want the best stuff you got.
The highest THC level you got. Mostly, I think a lot of people, there's two big factors for health issue, is anxiety, actually three, that's not true. Anxiety, lack of sleep, and pain. So I think those are the three top ones, and people, look for high THC. I just want to be knocked out. I can't sleep, right, Cody? I just want something that's just going to put me out. There's that. And then huh?
I said, then they get too high of THC, and then they get
right.
They can't sleep.
Right. So there's that. I mean, they do that. And then the anxiety, which you definitely don't want, and it's important that the bud tender understands what the goal is, because, we've talked about this in the past. With anxiety, you don't want a high THC level. And you definitely don't want a strong sativa, because that just elevates everything right there. And your terpenes, if you have an aversion to a certain terpene, that's going to escalate your anxiety too. So it's really important that that the bud tender and the consumer understand all those working parts as they try to find the right product for them. I was listening this weekend to some podcasts, and with the PTSD, somebody says, oh, he's got PTSD, let's get him really high. Yeah, you got to be real careful. You've got to be really careful, because some of the high THC, some of the sativas can exacerbate symptoms of PTSD and bring it forward, and that's not good. So it's important that you do know what you're looking at.
Like with my condition, like I definitely run way high anxiety. And that's like the biggest reason I stay away from sativas. Mostly because it boosts that feeling, and I don't want to feel like that.
Right.
But I think it's really interesting, the questions, right? The questions that both consumers, when they come in, and the bud tenders ask. Like it's really both, like comes from both ways.
Right.
Like, when the bud tender says, what are you looking for? Like hopefully the customer would be like, well, I want to feel like this, or I'm looking for, to get rid of this or that.
Right. And that dialogue is really important. And Cody, we talked about this last week as far as, hybrids, there's really no true indica, no true sativa. The majority of products out there are hybrids. So understanding the goal is going to direct you towards the right product, the right strain.
That's when like terpene profiles and stuff have a big play as well, especially now. And also, just to piggyback, like you also got to watch out what you're smoking and the quality of what you're smoking as well. You don't want like a lot of you don't want to smoke a lot of leaves or water leaves, stems and stuff like that. You want to make sure you're smoking the actual bud, just to make sure, because some people get headaches, I'm
going to task you in the media team to do a how-to video on cleaning your flower. You ever noticed that? That's like that's a very good thing that you brought up though, Cody, because have you ever watched like how to roll videos or just like things like that? Like they don't really go into like how you clean your bed, and like people don't really understand that. Like you need to really not smoke your stems. Like please get rid of your stems. Like I
I mean,
see
Snoop Dogg said it a long time ago. No one
they just like put it all into the
listens.
grinder and you're just like, wait, wait a minute. Don't put
Ever
that.
smoked a seed and then all of a sudden it goes pow.
Yeah, and then you just got a headache, man. You're like immediately have a headache.
Oh yeah,
But yeah, so it definitely overlaps. And I think this really comes in, like I always talk about this out in the community at large, because you know, a lot of people in our community don't really understand the recreational use because the medicinal has been around for a while, and they don't really understand the overlapping until you kind of like put it to them, like I put it to them, to people, almost like a side effect, right? Like if you take an opioid, you're really trying to kill some pain, but the side effect of that is really a high. Like
Right.
feel that.
Right.
Yeah.
Kind of similar. Like they're
Right.
like, and a lot of people that take cannabis for pain, like it's being used on their pain, so their levels, like they may not even get like a head change because like it's all being used on to like combat that pain, so they may not even feel, you know, a head change at all. I always think that's just like a side effect of it. Like if you're using it medicinally, you got to know that that might be, you know, something. And recreationally, I think everybody kind of anybody that uses cannabis only purposely for recreational use, you're always going to have a medicinal side effect, whether you want it or not.
Right. Well, yeah, absolutely.
Like you're going to have some decreased inflammation, and you're going to feel a little bit better. Like that's just what happens.
Right. Right. Absolutely.
All right, so let's get into it. So let's talk about inhaling. So the reasons why you wouldn't want to inhale if you have, you know, compromised lung issues, any kind of upper respiratory, anything, if you have any conditions like that, you definitely want to stay away from smoking. Public health, we just always say, like nothing's supposed to be in the lungs but air. Like that's why we're always talking about air pollutions and like PMIs and pollution. Like I can really get into some air quality stuff.
Yeah. Well, and there's a difference between smoking a joint and vaping.
There is a difference between there too.
Yeah.
Hey, Cody, do you want to talk about that?
Cody?
So vaping, you just heat it up to a certain element, like a certain heat temperature, depending on if you want a low temp hit, a high temp hit.
And why do those matter? Those different temperatures.
The terpene profiles. A lot of the terpene profiles, some terpenes burn hotter at hotter temperatures than others do. Some don't. It just depends. And that way you can actually put some relief on your lungs as well. I mean,
Right.
yeah, it's depending if you're going to be doing like vaping actual flower or vaping concentrates as well.
So really, like vaping is a little bit more. I mean, we don't really know much about it still, because like smoking's been around forever. But you have combustion with smoke, and that's just pretty much all around with your.
Yeah.
You don't have combustion when you vape. It's just not there. But we definitely know that. What do you want to say the difference between of like vaping flower and vaping concentrate?
Just the intensity and the concentrated level. You know, it's a lot more concentrated. 80 to 90% THC compared to the flowers, usually around 20 to 30%. So it's a big difference there. The hit, you know, or the high itself is going to be a lot different. If you're experiencing a lot of heavy pain and stuff like that, I would actually suggest vaping concentrates because it's going to get the job done that much faster. Stuff like that. If you wanted to take an easier strain on your lungs, just in general, then you can vape flower as well, like a volcano or something like that.
Mhm.
So.
It's definitely for medicinal purposes.
Mm-hmm.
Dabbing concentrates is so effective for pain relief. Like it's just amazing how like quick it can relieve. I've just seen people. I'm sure you guys seen people too. Like have very very high chronic pain for years, and their first dab they take, and they don't even get. And it's amazing. I always think this is amazing. And I was talking about this before, but I always think it's amazing. People that have very high pain in their lives every day, daily pain. They're just used to this pain, and then they take cannabis, like concentrate, like something like I would take. I mean, I have pain too. That's cannabis helps me with daily, but not on the extent that people with chronic pain I'm talking about. They just don't. It's what cannabis does to them. Like they just don't get as stoned. I'm trying to say. Like if they took the thing, like they took like a I don't know, a half gram dab, right? Like just like say like somebody's like in like so much pain, they're on opioids and very high medications, and say they took a really high gigantic dab that you and I would take, and we would just be out of our minds. We probably just pass out. But that person that has a lot of pain, that just works on their pain, and they don't even have that much of a head change. I always think that's just amazing how that works. Like
so cannabis is a triage. Once cannabis enters into it triages. So those who have a high pain, that's the first thing that the receptors are going to
target, right?
Are going to accept. So it's like it works the same with prescription medicine. So whereas a person who's in a lot of pain, they would take like, let's say, 1 or 2 tramadol, which somebody who's just experiencing a little bit of an ouch or a little bit of a headache and they took a full tramadol or even 2, knock them on their ass. I mean, like for the next 12 hours, they're drooling. Whereas that person who's in a lot of pain, that doesn't touch them. So cannabis works the same way. I had a patient who wanted to start with cannabis because of his knee pain, and he knew about my knees and everything else. Bottom line was, for the first 2 months, he was not really feeling a lot of pain relief in his knee. But what happened was his blood pressure went way down and his cholesterol went way down. And by the 3rd month, his knee pain started to go away. So it actually triages what are we dealing with here that's more important. So it does it on its own. So that's why people who have a really high pain issues and stuff, when they do smoke the dab and they do take the concentrate, that smoke the concentrate, that they don't get as obliterated as anybody, because they're not, it is now functioning in their body to address an issue. So it's actually beautiful that it actually does its own triage, because what you may think is more important, that your body heals, and I may think it's not so much. They take it into consideration what else, what needs to be addressed first. So the cannabis is amazing in that aspect alone. It's just amazing to me. So
yeah, I wanted to touch base too. My mom's friend actually was in a crazy bad surgery. I don't know if you heard about the doctors that were using fake pins and stuff in their bodies and stuff like that, and it wasn't like real steel and stuff like that.
Yeah, black market.
She's been going through crazy pain. Like all of a sudden, like what part of her body will just go into crazy pain. So when she smokes, I mean, I'll dab her out and I'll be obliterated, and she's high as shit for like 5 minutes, and then she's sober again. And then I gotta keep on getting her high. It's like a job, literally. Like there's gonna be jobs out there for people like that. Like just getting people high is gonna be a job.
Yeah.
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 Because I'm like, how the hell? And she's fine. 5 minutes later, I'm like,
But her pain is
Yeah.
gone. And that always comes back, right, to why cannabis in our endocannabinoid system really work together to try to make our bodies normal.
she'll eat like
Yeah.
1,000 milligram edibles, and it's just like nothing.
Exactly. Yeah. I was going to get
Right.
that.
Right. But here's the, I mean, so take that into consideration and think about this. People who are in that kind of pain. And I've been there, and when you're in that kind of pain, I always used to say, if there's a loaded gun around you, use it. But this is how overdoses happen.
Yes.
So when you're in opioids, you're trying everything you possibly can to get rid of that pain, and you just keep consuming to the point where you either destroy your liver or your kidneys, or you overdose and you die.
Right.
Whereas cannabis, it's not going to happen. You can consume a whole lot of cannabis and it's not fatal, you know? So, but this is how overdoses happen in the opioid world.
Exactly, Ange.
Good touch, yeah.
Let's just go over this quickly. If then there's anybody new that's going to be watching this, because this is going to live on our website. So inhaling or vaping, it's the fastest way to get cannabis effects. It's the quickest relief. I even know people like in the autism world that keep vapes for their, their kids or their adult kids. Because when they go into an episode or something, they definitely grab the vape and they give it to them, and it's quickest to get them back to their, calm down.
Yeah.
And it usually lasts about 2 to 6 hours, depending on the person, usually.
Right.
What it is, it's flower or concentrates. And this is about what happens. About 10 to 15% of that cannabis components are inhaled, and that's how it gets into your body. All right. So ingesting.
Edibles.
Yes, Cody, I have totally seen people like super sick, like people on chemo, and like eat so much cannabis, and you're just like, wow.
I was amazed.
They just feel better. They just feel better, and they just want to eat a meal finally.
Yeah.
Right?
Finally. Cool. Like if I ate that, I would just be dead for days.
Yeah.
Yeah.
Yeah, and I'm actually gonna give her some of the 2,000 milligram butter too. I want to see if that will work.
Good. I mean, that's a big thing that we still have to fight in our regulations for our medicinal patients is high.
Right.
And like the medicinal patients need it, and they always think it's like too much, but they just, our elected officials don't understand that.
Well, because they haven't experienced it. Let me just tell you, you give them one pain episode that a medical patient deals with, you give it to them for about a week or two, and shit will change because they'll realize, they will realize. Cody, the one other thing about that kind of patient and the medicinal part is keeping a level amount in the system so you don't have the highs and lows. Because when the pain increases drastically, it takes so much more to bring them down into a manageable state. I'm working with a patient right now who has shingles, who for 4 days was at a level 10. And I mean, by the time I got to him, his body was convulsing with the pain, the sharp pain, surges and stuff. But and to be honest, it's an edible every 2.5 hours. And we've been able to keep him at between about a 4. And that's totally tolerable. It's totally manageable for him.
What's his dose every 2.5 hours?
It's 10 milligrams of an edible, of a gummy. Give him one gummy about every 2 hours, where normally that would last you, like you said, 4 to 6. But he's been having breakthrough pain at about every 2.5 hours. So if we keep him at that level, so you may want to try that, a steady regimen of consuming to keep that steadiness of cannabis in her system. It'll also get her body to relax and help itself on its own.
Yeah, because she's eating like a couple 100 milligrams every couple hours.
Yeah.
It's just like,
wow. Yeah, that's a lot.
Because you have no cut, like you can't really like time when it's gonna happen,
Right.
stuff like that. So it's like,
Yeah. So it's better, yeah, to like what Deandra was saying, do like some kind of base, like you just keep a base in your body.
Yep. Keep a base. Yeah.
keep them loaded.
Yeah. And then you just kind of add on. How I mean, that's how I take it during the day. Like that's where my tinctures come in, and
Yeah.
Right.
those all come in during the day.
So the edibles end up, like you do, they go through your digestive system, and and it does a chemical change as it passes through your liver, and it breaks down, as you've got there in the slide, to 11-hydroxy and 11-OH THC. And that's something to consider when you're doing an edible. It's going to take a little bit longer to kick in. And I've seen, I know you guys have too, where an edible may take 30 minutes to, it may take an hour and a half for other people. For me, an edible takes roughly about an hour and a half before I start feeling the effects. But I have talked to patients, they say within 30 to 45 minutes, they feel it. So that's your own metabolism that's causing that effect. So your metabolism and your endocannabinoid system is different than everybody else's. So you just kind of got to experiment. And if you're a first time user, by all means, go half. I had a couple of gals came into the dispensary, and their friends were, taking the full, the 10 milligram dose. And she said, I just took that piece, and she said she had a very, very bad experience. And I said, okay, so first timing, just cut everything in half. So that would be the suggestion.
I would say a golden rule for people, like just, their first time experimenting with any kind of edibles or ingesting anything, start between 2.5 and 5.
Yeah.
Very, very low, just to see how you feel.
Right.
I
Exactly.
wish I could get high off of 5 milligrams.
You can always add more, but you can never decrease it. Once it's in
Right.
you're gonna have to wait it out.
Yeah. Who knows? If you can achieve that with doing half, it saves you money.
Yeah, right.
Exactly.
Cheap high.
It's like a cheap drunk, Cody.
Yeah.
There's some of us out there that are just very sensitive to this 11-hydroxy THC. I am
Right.
totally one of them. So as I could vape or smoke all day long, like literally, and take tinctures too. Like even I do we'll talk about that later. But anytime it goes and passes through my liver and I metabolize that, it makes my high like 100 times. And I'm never, I'm not ready for that. So I always take like little bits here and there.
Right.
And even at night, like if I have like a really bad sleeping night, I know it's gonna, like I feel like it's like I'm not gonna sleep. I will take, I'll take a good, probably 40 to 50 milligrams, because I know that will keep me asleep.
Yeah. There's no better sleep than an edible sleep.
Man.
Why do you always get so red-eyed and the worst case of munchies on edibles? I don't get that part.
I think that has to do with how it metabolizes. I really think it's the 11-hydroxy, like just that change in that THC.
Yeah, because I can smoke all day and I won't get the munchies like I do on edibles. Once that hits, it's like open the cabinet.
So good for people on chemo, man. Like,
Right.
I'm just like, here, eat this whole edible. You might need a couple 100 milligrams before you feel something, but eat all of it, because then you'll actually want a meal after this.
Right. Well, that's what was happening with that patient that I've been working with the what did I just say he had? It just lapsed. He wasn't eating with shingles. He wasn't eating. The pain was so bad, and he hadn't eaten. By the time they called me, it had been 4 days. He hadn't really eaten anything. And so, yeah, within 2 days, he was eating a full meal. So it was, and your body needs that to heal. Yeah. Your body needs that fuel to heal.
Definitely.
So,
and there's all different kinds of things to ingest out there now. Like,
right.
We come a long way since Brownie Mary's brownies, which are still
Right.
come a long way from there. Like we got mints, we have drinks, we have syrups. Like I think the syrups are really cool. Not even for just recreational, like fun making mocktails, but for medicinal purposes. I really think the syrups they're very cool to use. And especially the ones that we have that are gluten-free, sugar-free, like I just think it's
Oh, yeah.
Punch that they pack and it actually hits relatively fast. Because a lot of them are full spectrum.
Yes. So yes, exactly. So that's a good thing to look for too. Is full spectrum.
Always.
Yeah, all or nothing. I love full spectrum now. I'm like, yes.
It's different, right? You're just like, this is it.
15, 20 minutes. I'm like, bam.
Right?
Yeah. Sometimes it'll hit fast.
They do.
If I ate a lot. If I ate a lot that day or not too, you know, like in the morning, if your blood sugar's low and you have edibles, it's like the best high. But
Yeah.
you know,
You're just like on an empty
the more
stomach.
you eat, the harder it is to feel it.
There are coming out with, they started, you know, our fun cannabis labs out there, because now we get to, you know, since legalization, our crazy scientists are actually get to do crazy scientist stuff. So we're going to be seeing more and more water soluble
Right.
things out there, I think, coming our way, which is going to be cool because that's even quicker onset.
Much quicker, quicker and more potent.
And more potent. So then
Yeah.
you could really replace, you know, some people that have a problem, you know, that alternative to smoking and vaping, it could be a quicker relief for people that need that too.
Right.
It'd be cool.
You know, I also love is CBD water. I love CBD water. It's an awesome thing to have around at all times.
Yeah.
Especially if you get too high.
I put it in my water. Like I usually put it in my drinks every morning, and that's how I take my CBD.
That's cool.
I know we're going on to the next slide. Okay, so I wanted to say something about the gummies. It's okay. Stay on this tincture one. So with a gummy, well, you go to the next slide, Pam. Go ahead to the tincture. Okay. So the tincture's sublingual and it goes under your tongue. And that is one of the methods that absorbs the bioavailability for up to 20%. So it's a very good absorption, gets into your system. It maximizes the amount of cannabis that enters into your body. But you can also, so I just want to touch base on this because I tell people this when they come into the dispensary and they get a gummy. If you get a gummy and you chew it a little bit, chew it up, break it up a little bit, and put it under your tongue and let it dissolve under your tongue, then it becomes a sublingual. So it acts very much, it does not inedible. So it does not pass through your digestive system and through your liver. So it's faster acting, more potency. And so handling the gummy that way gives you a little bit better benefit than an edible. Because sublingually, which, you know, this is my favorite, but absorbing through the mucous tissue and the membranes, when you get it into your system and it goes right in, it stays longer, it's a little more potent, and you get a really good relief from it. And you can monitor it easier. So when you are taking medicinal, tinctures are very easy to monitor as far as what you take, how much you take. You know, you can start out with, you know, 50 milligrams, and then say, you know, 4 hours later, you need another 25 milligrams, or you might need another 50 milligrams. But that one is an easy way to keep a steady level of cannabis in your system when you are, you know, dealing with it for medical.
It's definitely there to keep it consistent.
Yeah, absolutely, absolutely.
I'm always waiting for us to see. Oh, I totally see a typo right here. Shoot. It's okay.
But and if you look, whereas we say, you know, you can add the tincture to you know, your drink, whether it be hot or cold, or if you add it to cooking and stuff, but then that becomes an edible. So understand that. So once you add it to something that you're going to ingest, then it becomes an edible. So then the bioavailability starts to drop and the potency starts to drop. So just understand, it's absolutely You can absolutely add it to, and I have many patients, they can't stand the oil or the taste or whatever product they want to add it to food. And that's fine. Just understand that it then becomes an edible rather than a sublingual.
And it has to be digested.
Yeah, and it has to be
You
digested.
have to go that whole route instead of passing that and go directly to your blood system.
Right. And you can use, so you can use tinctures as a topical. I use it every day on my face. I'm getting old. I do not want to look like that as much. So it keeps the inflammation down. It's a huge, it's a huge thing when it comes to inflammation. And then I can tell, I've told this story many a times. I've burnt my hand really bad on the toaster. And that throbbing pain when you have that burning, you rub some CBD oil on that burn, and within minutes, that throbbing stops.
Mm-hmm.
So, skin irritations, I cut my finger the other day with a knife, went ahead, got it washed, and I immediately dropped CBD oil right into it, because it's also antibacterial, antifungal, anti-inflammatory. And, it didn't get red, it didn't hurt, it wasn't throbbing. So you absolutely can use it as a topical.
Let me say one thing about RSO too, which is Rick Simpson oil, which is just concentrated oil made a certain.
Right.
But that guy just put it on the map.
Yeah, I did.
That is very highly concentrated, and it's so good. Like, I've seen people use it on their skin for different things, from like helping with their, like, an additional thing to their skin cancer treatment, to people with eczema, but people also use that as an ingestible RSO,
Right.
to other elements. So, like, if it's very highly concentrated like that, you could definitely help aid it in other skin conditions.
Yeah, absolutely. Because some of those, and I know you see them on the commercial where they have you take the prescribed medicine, they're so potent and so bad for you that every 3 months you got to go in and have your liver checked to see that the liver is still functioning. Yeah, and if you use the RSO on topically, it does better than a majority of that prescribed medicine. So anybody, before you would take that prescription, I would absolutely strongly suggest that they do the RSO oil. Really strongly suggest it.
Like, I always think, like, what if I used that when I was, a teenager in my early 20s? Like, I had acne.
Oh yeah, absolutely.
I had some, like, definitely had some. And, like, what if I, like, had cannabis oil back then and I just, like, rubbed it on? Like, would it work? Like, I wanted.
Yeah, it does, because acne is caused by bacteria, and cannabis is an antibacterial, antifungal. So it absolutely would. If anybody out there has ever used that, what is that acne medicine that you buy on, what is it, Pro something?
Not Accutane.
Yeah, Accutane, yeah, something like that. If you
like your liver, and that's what I'm
right. Thinking. Well, if you sleep, I mean, I've had people say that their kids have used it. They go to sleep, they're sleeping on a pillowcase that's, maybe a colored pillowcase, like a blue or a green pillow, and they wake up and that pillowcase is bleached out. And I'm like, oh my God, and you're putting that on your skin, But yeah, so absolutely, it's a great topical for acne, because acne is caused by bacteria and fungus, and it's it's very strong antifungal, antibacterial, very strong.
There is. Sorry, guys.
It's all good. And the tincture bioavailability is anywhere from 12% to 35%.
Which is higher than, like in the beginning, if you remember, when we were on the smoking, vaping side, it's really only 10 to 15%.
Right.
So a lot higher for tinctures.
Right. Tinctures will get you there.
All right, topicals.
I always have a topical in my purse. I never leave home without it. I was getting ready to go someplace on Saturday, realized I didn't have my roll-on, my topical roll-on. I had to come back by the house and get it. I never leave home without a topical.
Yeah, well, when we used to go to parties before COVID,
Yeah.
man, everybody used to ask me for it because they always knew I had some in my purse. Like,
Right?
always had something on me, so they'd always go, Pam, yeah. Before I get gone and like, come by the shop, you're gonna have to pick up your own.
Yeah, exactly. When topicals for me, when I'm dealing with patients, I do, we've talked about this layering. I do a layering care plan. When people are in pain, especially like you have arthritis or joint or, that kind of pain and stuff, people want to feel immediate relief. And topicals do give that within a few minutes, you feel that relief topically. So I usually work with them and they take a tincture, and the tincture heals from within, and it stops that pain message being sent, and it helps the body's inflammation be reduced, which is causing the pain. But when they can feel that immediate relief, they calm down. So that anxiety that comes with pain is alleviated. So they in turn relax. So when they relax, then they don't tense up, the pain level drops. And this is one of the biggest reasons I use a layering protocol when it comes to pain management. The tinctures obviously will help sustain and cure and work from within, but the topical alleviates it pretty much right away, giving them that instant relief in their anxiety levels that come with pain. Pain has a lot of anxiety with it. It diminishes. So you have a quality. There is a quality. I used to start my lectures, people would come in, they'd have neck pain. I'd have my sample roll on. I'd have them roll it on their neck. And before I would even start, I'm sitting there watching them move their head from side to side, and they got this smile on their face, and right away they turn around and go, oh my God, I can feel the pain just dissipate. Topicals also depends on your carrier oils that are mixed with it. Those are important because it does help with absorption. You've got camphor, you've got menthol, you've got emu, and you also have cryotherapy, which is a cold therapy, which is more on the analgesic, numbing kind of side. So that's something when you're looking at a topical that you'll want to look at. But I also have several patients who can't use menthol. So you've got to be careful and know what's in your what's in your topical that's going to be the carrier oil. I've never had anybody have an effect with the emu oil, which is a deep penetrating. It takes the topical into a deeper penetration. So that's pretty important to know what's with your topical. And I always like a nice strong carrier oil that's mixed with it to help.
You guys like bath bombs?
Huh?
You guys tried the bath bombs?
Yeah. I can't say I'm better with getting out and taking massage oil and rubbing it on than I was the bath bomb.
You should carry them though. That's people ask about them all.
They do ask for them. There's lots of people who do like them.
You can make a lot of money on those ones too.
Yeah.
Yeah, I like the bath bombs too. I definitely like it. They're definitely not, I mean, I'm not sure for, like you said, like it's better if you just like rub some stuff on you, like and get it like massage oil. But it definitely helps me with anxiety because it makes me like stop when I have to go take a bath and like sit there in the quiet for like, until the water gets cold anyways, a good 15 minutes or something. And it definitely helps. It definitely helps with, it's almost like Epsom salt. Like if you ever use Epsom salt for like
absolutely
sore muscles, it's like that, but 1,000 times better. That's like, it feels like I'm just like in a really good like mega Epsom salt bath.
Yeah. Yeah, that I will agree with you on that. I will totally agree with you on that.
Like makes me
That's
like
more right.
does that whole like muscle relaxer thing.
The decompression of the muscle tension.
Exactly. Like,
Yeah.
and I love this. Yes, I totally support that. We need to carry some bath bombs.
You guys ever make your own sobs and stuff like that?
I have in the past. I've totally made that in the past, like some little rubs.
Yeah.
Yeah, it's fun. Good. I have a friend that actually does that. She likes to do that. A couple people that like to do that. It's kind of easy to do. Like if you ever want to, if any patients come in and they were just like, they ask about it, like it's almost the same way as making can of butter.
Yeah, it is.
Yeah.
And especially if you're like in a high demand for it, making it yourself is a lot cheaper too.
Exactly how like our market is. Like you could still like buy some flour and just make your own.
Yeah, and you could buy like CBD isolate too. I mean, maybe mix it in.
Yeah, mix that in there, and then you can use your own whatever you like to use as
Scent.
yeah.
Right. Speaking of isolate, I want to touch on this one. I am very much, and we've talked about this, and y'all are very much a full spectrum fan, but I did have a patient who was starting on tinctures and found that she got agitated. And so we kind of played her a little bit around with the dosage, but she said years ago when she smoked, she said once in a while she would, I was trying to figure out, was it she having a reaction to the THC or was it to another cannabinoid? So as we talked, she said, in the past when I smoked, there's times that I would smoke a joint and I would be fine, everything would be good. And then another time I would go ahead and smoke it and I would be rawr, I'd be very aggressive. I would be, angry. I would, start to get agitated. And so after speaking with her, I realized that it probably wasn't the THC, that it was probably some of the other cannabinoids or a terpene that was making her react that way. Because, back then when she was smoking, nobody knew what was what. You smoked it, So I switched her over to an isolate and she's had no problem since. So there is a place in understanding what an isolate does and what it can do. So I just wanted to bring that up.
No, totally. And I mean, that's where all of our here, like we're on this slide, actually, the transdermal, like with the patch, like those CBN patches. I mean, if the edibles aren't working for me to sleep, because sometimes they don't, because sometimes I have just some bad.
They take too long sometimes to hit.
Sometimes they take too long, and sometimes they just don't work. Like I don't know what it is, and I'm just like awake and kind of stoned.
You ate a big dinner, you're like, it's not gonna work.
Yeah, yes, like something, whatever the factor may be. But the transdermal patches, if I get like a CBN, that CBN transdermal patch, it works so great. It just works really well.
Right.
Yeah. And so like I really think like those isolates, like isolating like some of those cannabinoids, they do have a place.
They do.
Even those tabs that we have, I think they're pro tabs.
The pro tabs. Yes.
I mean, they have a place. They'll have a place. I think it'll be more on the medicinal side of the market, but they definitely have a place here. And
yeah.
The more of having a place for people that need that kind of like direct, whatever that may be, direct effect.
Right.
Also, I wanted to share also, like with the transdermal patches, it's really good to put them on thin skin, like thinner skin on your body. I've heard that it works throughout your whole body, so you don't really need to put it on the actual spot that it works. But thin skin, like the arm, like in the picture, or top of your foot. And stuff like that.
Top of your foot. That's where I usually put it, is the top of my foot.
Yeah.
It just goes into your blood stream. It's just similar to the patches that we see in pharma. Like there's opioid patches, there's hormonal patches. So those just all kind of absorbed into your skin and then into your bloodstream.
Right. And if your first time using a patch, try half. Again, same kind of protocol. Sometimes a whole patch can be a little too strong.
I even tell people, if you've never done it before, cut it in thirds.
Yeah. Absolutely.
Yeah.
Micro. Yep.
Yeah. Micro it till you figure out which
I've never tried them. I want to.
They're really cool. You should totally try it. Like
It's like you can get high and then take it off, and you're like, I don't want to be high anymore. So you're
no.
No, it doesn't work like that.
It'll still be. I definitely used. I think I used like a one-on-one when I like my back went out.
Right.
You put it like right on the spot, and it worked really well. Like I was
Yeah,
like,
it really does. It really does.
very surprised. I just wasn't sure.
I've gotten a patient off of fentanyl patches using these transdermal patches.
That's amazing.
Yeah.
See, that's a
2 oxycodone and a fentanyl patch. That's what she was on.
Gosh, that's just. I just think
Yeah.
like your poor body, like
Right.
like function
Yeah.
in the pharma in you.
Some people used to chew on those patches.
Wow, that's
Ugh,
crazy.
that's crazy.
All I gotta say is wow.
My God.
So I think this is our last one.
Yes.
Right? Yeah, this is our last one. So mucosal membranes. We kind of talked about this with tinctures and how tinctures are absorbed under the tongue through your saliva glands in your mucosal membranes. And how the bioavailability is better.
Yeah.
More absorption. It's just a way better to use it this way.
Yeah.
It
doesn't break down.
Yes, it doesn't break down like your digestive,
Right.
even in your lungs too. It breaks down.
Right.
It's a spray.
So different places where your mucosal membranes are, because not all of us have had anatomy and physiology. But mucosal membranes. So again, your saliva glands, that's one. Another one is your nose. That's your mucosal membranes. You can definitely rub some tincture in your nose.
Right.
I always forget to do that. Like I'm always like, oh, I need to do that next time I have a cold just to see what happens, just to see, I don't know.
Right.
And I always forget to do it, but man, next time I want to remember it. I want to try it. Suppositories. Suppositories, because it enters the bloodstream actually very quickly with a suppository.
Let me tell you, suppositories were the method of delivery back in the 1800s. I mean, they had more suppository medication administered that way. That was the choice. That was one of the bigger choices, you know?
Passing your whole digestive so it doesn't get broken down in your digestive.
Right.
So yeah, suppositories. And another thing, if people, I know this is a little TMI, but I know this is a thing with people that have hemorrhoids. Like if people like suffer from hemorrhoids, like I know it's a thing. Cannabis suppositories are amazing.
Amazing.
Amazing for people suffering from those.
Right.
And then of course, vaginal, like all kinds of things, OBGYN.
So they're doing lots of studies too, Pam. They're doing lots of studies on vaginal suppositories for endometriosis, and they're having great success.
Great success. Yes.
Yeah.
I actually follow a few people, like a few cannabis people on social media that have endometriosis are in like that circle of doing those studies and that. And they're
Nice.
like breaking through like in big ways.
Big ways. Big
ways. And like my mom actually suffered from endometriosis when I was growing up. I mean, she finally had to have a hysterectomy and all that, as usually people do with endometriosis. But if I knew about this, like then I would have totally like showed her all about this, because I think it would have helped her like greatly. I'm reading so much stuff too. It's very true, Ange. I'm reading like several different studies have come across my way about that.
Yeah, it's amazing. I mean, it's a big infertility. That's a big issue with infertility is endometriosis. Mm-hmm. So they're making big strides, and so it's exciting. It's very exciting for women's health. That in itself is very exciting for women's health.
It's very exciting.
Doesn't it help with like women's cramps and stuff like that too?
Absolutely, 100%.
I heard about that. Some people use it during like pregnancy and stuff. How does that work?
I know some people that have like home births. Like I know that crowd, and People that I know that have home births, they definitely use cannabis. They'll definitely use cannabis during their labor and delivery on inflammation on delivery. They say it works wonders.
Yeah. They're still doing a lot of studies, Cody. So there's not, even in a lot of my books and a lot of the journals and everything, they still will not come out and make a stance as far as the medical world or anybody doing that because they don't have enough evidence or whatever. But Pam's right. A lot of the holistic home births and the doulas, a lot of them use cannabis and a cannabis rub while they're in labor to help alleviate some of that inflammation and that pain, making the delivery easier.
And talk about like, I mean, on the recreational side, like there's definitely cannabis lube out there. That's amazing.
Yeah.
Like it's definitely couples.
Is that what we have? The love potion? What is that?
Maybe I haven't seen that, but maybe that might be. I'm not sure. I know we used to have some on our shelves. I don't know if we ever.
A lot of people ask me about that stuff too. Like
they do because it works. I mean, again, it works like it just helps people in different.
Right.
It's anti-inflammation, and you know.
Right.
Yeah. So it's awesome. There's also oral sprays and nasal sprays. So like instead of like rubbing the tincture in your nose for mucosal.
Right.
You can also do like a nasal spray.
you can huff it.
Yeah, right. I was thinking like it's an allergy spray because I've always had allergies. So I've only used like nasal sprays or allergies. I'm just like, wow, I wonder if it could help with my allergies. Never know.
Poppers.
Yeah.
Right. So that is it for our methods of delivery.
Oh, one more thing about the
Oh wait. Sorry.
What's it called? Inhalers.
Yes, inhalers. Those are actually coming out too.
They are starting to come out. They are.
I forgot about that. Thank you. I didn't even put that on here. But
I mean, I'm just
yeah, that is one, inhalers.
Those
Because
are really cool.
of some of the because cannabis is a vasodilator, it really helps. It does help with people that have asthma.
Mm-hmm.
Yeah.
And especially if it's has high pinene terpene in it, it's definitely going to help even more.
Right.
There you go. See, you're onto something.
Yeah. All right, guys.
That's great.
Thank you
The
very much.
wrap.
We'll have this up there for your
Yeah. Happy Monday, everybody. Thanks for tuning in and listening. And I hope it was good information.
Yay. Who is that?
Blue cookies.
Hello.
Nice.
Yeah. That's fun.
Babies.
Little baby.
Yeah, guys.
Little nursery. All right, guys. Well, happy Monday. And
Happy Monday.
Have
Thanks,
a good one,
Pam.
guys.
Thanks, Cody.
Yep.
Bye.